Okay, so in this video, we're going to go over some different treatment ideas for acute care. I know a lot of you have been asking us for ideas, so for the sake of this video, we're just going to go over some more general treatment ideas, nothing really diagnosis specific. And then just to point out and to note, in acute care, we really are pretty limited on our supplies, so that's where your creative OT side comes in. So definitely think of all the different things you can do and get really creative and have fun with it. So first I'm going to start off by showing you guys a couple of things you can do with a lower level patient, someone who might not have the ability to get out of bed yet. So my patient here, we're going to work on bed mobility. So this is a great treatment idea as that transfers into the progression of sitting up and then eventually standing. So here I'm going to have my patient practice just rolling from side to side and getting those movements down first. So I'm going to have my patient bend her knees up if she's able to, and then I'm going to have her roll over to the other side of the bed, and you want to make sure the bed rail is up so they don't accidentally roll off on the other side of the bed, and you can just put your hand on their hip and on their shoulder to help guide their movements, and then we're going to roll back onto the back. And then same thing, rolling towards me. So you can help them out if needed. And then rolling back on her back. So those obviously can progress, and that might be a lot harder for certain patients than others. And if you're lifting more than about 30 pounds, you should definitely have a second person to help assist you. And then you can also do some bed level therapeutic exercise. So I'll have you straighten your legs back out, and you can have them just practice bringing their arms up over their head as much as possible. And if they don't have that kind of strength, you can do more so passive range of motion. So holding up their hands and getting a good position here and bringing the hand up and back down. And so any sort of active range, passive range that they're able to tolerate and do is a great therapeutic exercise at bed level. You can have them bring in their heels towards their butt. So like heel slides, those are really great, and flexing their ankles up towards their face, and encouraging all kinds of movement while they're laying in bed just to keep their body moving, get the blood flowing, and encourage any sort of mobility. And then another activity you can do to work on more ADL type tasks, you can practice hygiene and grooming tasks in bed. I wouldn't suggest doing like toothbrushing or self-feeding unless you have the head of the bed up at a good angle so they're not choking or aspirating. But as far as grooming tasks, you can get a warm washcloth, cold washcloth, whatever, and try to hand that to your patient and have them practice just bringing that to their face. So I'll hand her the washcloth. Good. But yeah, so those are just some treatment ideas, very basic, and you can add more or take a few things out of that. Just very good starters for a lower level patient. Good job. Okay, so now progressing to a little bit more of an advanced patient, like a mild level patient, I would say. We can work more on seated tasks. So here the patient is sitting up, and she luckily has good posture and good seated balance, so we don't have to worry about having a second person helping stabilize from behind. But something you can work on a lot here is ADLs, so hygiene and grooming tasks seated, and with the tray table in front, you could use that as a support too. And then upper and lower body dressing techniques. So I'm just gonna have the patient demo using the sock aid, and I'll teach her kind of how to use that device and Yeah, but recommending any sort of adaptive equipment to your patient, and as well as DME, talking about shower chairs, bedside commodes. These are all good things to do for a mid-level patient. So here we have the sock aid, and I'm just going to explain to her that you want to scrunch up the sock and place it on the end of this device. And of course, all of this is kind of dependent on the abilities that your patient has. You might have to help them out with this a little bit. Okay, so you want the sock to come all the way up towards those jump rope cables, just like she has it there, and then you'll have them lower it down towards their foot, keeping hold of the cables, and you slide your foot in and pull it on up, and perfect. She's got her socks on. So that's a really good activity to do with a mid-level patient. And then same with lower body dressing. We have a pair of pants. If you don't have patient personal clothing, or if it's dirty or something, you could, sometimes they have scrubs. Depending on where you are, you could use scrub pants. Otherwise, personal belongings are good. So these sweatpants, I'm going to teach her how to use using a reacher device. And again, I'm just going to explain it to her and show her how to use it, but if you don't have access to this at your place, you can get creative using the cross leg method. I use that a lot and trying to teach them how to do that. Exactly. So we'll use this for the sake of this treatment idea, but I'm going to have her get one of the pant legs all scrunched up, and then using the reacher to grasp that little piece of the pant there, and then bringing it down towards her leg, threading it over her foot. That's usually the hardest part. And then pulling it, using the reacher to pull up the waistband to a point where she can reach it. And then you're going to do the same thing to the other side. And if this were a stroke patient and you wanted to do hemi techniques, you can use this same technique, but you would want to start by threading the affected leg in through the pants first. And if they get stuck, yeah, you can provide a little bit of assistance there. And you get it up to the point of doing that. And then since she has great seated balance, we can do a little bit of weight shifting in order to pull up each side of the pant. So I'll have her lean one way and supporting her. And it might take a few tries. But there you go. So good. So another good treatment to do. And then also, like the last one, you can do more therapeutic exercise, and you can incorporate some more strengthening tests instead of just range of motion. So if you have any little like TheraBands or little bottles, like lotion shampoo bottles, you can use that for hand strengthening. Those are really good. And then just having them bring their hands up over their head and back down, that's a good one. I like to do a lot of shoulder and back stuff, so doing a lot of shoulder shrugs, and then having them bring their arms out towards their sides and squeezing their elbows together behind their back. So these are all really good exercises that you can do. And then I love incorporating the tray table for a lot of my treatments. So we don't have one here, but if she had a tray table in front of her, you can use that for fine motor manipulation, visual scanning. You can have her organize different items within the room, like the toothbrush, the hairbrush, mouthwash, whatever it might be. And you can use the washcloth and have her practice scrunching it up on the tray table into like a little snake-like position. And then you can also use that by putting her hand on the washcloth and having her like reach out, getting that good range of motion in those types of exercises. So those are all really good things that you can do. And then to progress to more of a standing position, if she's still not able to do that quite yet, we can do some weight shifting. So I'll have her put her arms next to her and then practice like she's gonna stand up. So putting nose over toes, leaning forward a little bit and trying to lift her bottom up off of the bed. Good. And then you can also, if they're able to, have them kind of scoot themselves up in bed, back and forth, and practice that. So these are just some general treatment ideas. Get creative with it, have fun with it, use the resources that your facility provides you with. But these are some good ideas for a mid-level patient. Good. Okay, so for a little bit of a higher level patient who is able to do more functional mobility tasks, we can have her start by standing up, whether they use a walker, don't need a walker, just, be mindful of that kind of thing. I usually like to start more conservatively if you're not sure and use a walker. And you can always take it away if you feel that they don't need it. But for the sake of this video, we don't have a walker, so she's very high functioning. So I'm gonna ask her to go ahead and stand up, and I have the gait belt around her, so if you do need that extra hand, but you don't wanna yank it too hard on them. So when you're ready, we'll stand up. Good. And then I like to just assess, make sure that they're not feeling any dizzy or lightheadedness, like they're gonna fall over. So I have them stand here for a little bit before really moving away from the bed. But while we're standing in this position, we can do a bunch of activities. We can do more therapeutic exercise, so some active range of motion, some strengthening if I give them the bottles to do these little bicep curls. So whatever sort of exercises you think are fitting. And then you can also do more standing ADL tasks, so you can have them get their shirt on while in standing, because a lot of us typically do that at home anyways. And then as far as the pants, you would probably want to have them thread them on when they're sitting down, but to pull them the rest of the way up, you can have her stand up. So those are really good activities. And then doing a bunch of transfer training. So right now we're going to practice toilet transfer. It's different than your usual hospital bathroom, but we'll work with what we got, like what we do in Acute. So we're going to head over to the bathroom. Okay, and then I'm gonna have my patient make sure she's in a good position in front of the toilet. And usually there's a grab bar they can use, but not everybody has those at home either. They might have a sturdy vanity that they can use to help lower themselves down. Or you can even put your hand on the toilet seat. So I'm gonna have her use the vanity here, if she's able to reach it, and just kind of slowly lower herself down. Good. So that was an excellent transfer by Lauren here. But you can practice transferring to the toilet, into the wheelchair, whatever the needs of the patient are. So we'll go ahead and stand back up. And head back over to the side of the bed, or you can stand up at the sink. And another treatment idea you can have them do is their hygiene and grooming. You can have them simulate home management tasks like cleaning around the vanity, tidying everything up, organizing. So those are all good little things you can do. And then we'll head back over. We'll have her sit back down on the edge of the bed. And you can provide them with education, of course. So I'm going to educate her on DME if I think that she might need it, like a bedside commode, and then any adaptive equipment for dressing or a reacher. Whatever I feel is fit for my patient, I can educate them on that. And then if I noticed from going to that toilet transfer, she needed a couple rest breaks, she's feeling pretty short of breath and tired, I'm gonna go over some energy conservation techniques with her and any sort of like pursed lip breathing techniques, pain management. There's so many different things you can do in acute care, which makes it kind of fun. Your resources are a little bit more limited, but get creative with it and have fun, but most importantly, be safe.